Hi, everyone. Thank you for joining us. Good morning, good evening, wherever you're joining us from. Um, Before I go into introducing the event and introducing our co-chairs for the Health and Nutrition Work Group, I just wanted a moment to introduce myself and SID Washington. My name is Malvika Randive, and I am the program coordinator for SID Washington. And the event today is a public event that is hosted by the Health and Nutrition Work Group. As you can see the title on the screen. If you would like, please, you can introduce yourself by putting your name and your organization in the chat. I also welcome all the speakers and our co-chairs to do the same. A few things to note before we start the event. This is a recorded session and it will be shared publicly through our network and our social media channels. We also do have live transcription, closed captioning available, which I have enabled right now. And you can activate that through your own personal settings if you go into more. If you have any questions for the speakers today, please put them in the chat box and we will make sure to get to them during our Q&A portion of the session. A few things about SID Washington. We are the largest and the most active chapter of the Society for International Development, an international network that was founded in 1957 to serve as a global forum dedicated to sustainable economic, social, and political development. We serve as a global town square for the international development community, bringing together people from diverse organizations, disciplines, and career stages in a neutral, independent forum to share information and discuss important issues and challenges facing our community, as we are doing today. We will be sending out a survey towards the end of this event, but we also have a link here if you would like to follow it. Please make sure to submit a survey in. It just helps us to improve our events as we go forward and listen to our audience. We do have a quick poll just to understand where everyone is joining us from if you would like to participate. All right. So I do see we have a significant number of audience members who are not members. Welcome to SID Washington, and those who are returning and are members, welcome back. And thank you for joining us from wherever you are. And then finally, I'm going to turn it over to Stephanie Vasquez, who is one of the co-chairs for the Health and Nutrition Work Group.
Great. Thanks, Malvika. Good morning, good afternoon, good evening, everyone. My name is Stephanie Vasquez, and I am the co-chair of the Health and Nutrition Work Group. I also serve as Global Health Director at Bixel, which is a woman-owned small business based in Fairfax, Virginia. As being a co-chair for the Health and Nutrition Group, we look to organize sessions around relevant and timely topics that would be of interest to the global health community. And so today, many of us are really working in this space, are routinely using the terms locally led development, capacity building, or country ownership in our daily conversations and with colleagues and partners. And we often use these terms in our technical solutions, presented in proposals or for any documents, but we're often not afforded the time to kind of step back to reflect on what do these terms really mean? And how do these terms relate to, power, decolonization of aid and equity, and other concepts as we start to surface, as we look deeper into the meaning behind these words. So today we want to have a conversation around this and conversation with leaders in the global health space. And so we hope today will be an opportunity where we can learn from each other on how these concepts are being heard and interpreted through each of our individual lenses, and an opportunity to surface any blind spots that we may overlook in our work. In organizing this event, I collaborated with my fellow co-chair, Erin Wheeler, who joined as co-chair earlier this year, and also with Olivier Alegbe, who will be our moderator for today's event. We worked together to design a session that we hope will be informative to our work in global health, but can also provide varying perspectives in this area. So we look forward to your questions and this conversation today. And I also want a chance to introduce our moderator, Olivier Alegbe, who will be leading us in this conversation today. Olivier currently works for MSH, and he serves as the Director of Global Partnerships and Strategy. He's been with MSH since 2016, where he first started as Senior Manager for Corporate and Foundation Relations, where he worked extensively with the private sector to create new partnerships. He also was appointed as the country representative in Nigeria, focusing on business development and partnerships. And prior to that, he also served as portfolio director for the Global Health Program and managing operations in the Nigeria country office. He holds a master's in public health and health services management from the London School of Hygiene and Tropical Medicine and a certificate from the Harvard Business School. He's also fluent in Yoruba and Russian. So I'll go ahead and hand this over to Olumide, who will lead us in today's discussion.
Great, thank you, Stephanie. Good morning, good afternoon, good evening to everyone. We appreciate you taking the time to join us for what promises to be an exciting and much needed discussion today. As Stephanie mentioned, my name is Olivier Alegbe, and I currently serve as the Director for Global Partnerships and Strategy with Management Sciences for Health. MSH is a mission-driven nonprofit that works very closely with countries and communities to save lives and improve the health of the world's poorest and most vulnerable populations by focusing on building strong, resilient, sustainable health systems. As Stephanie mentioned, our panel today is focusing on the sort of the conversation around capacity and capacity development. I think, as she mentioned, often we hear about capacity development from the perspective of the donors or those in the global north, and often from a place of what remains to be done. For this panel, we're hoping to talk about the capacity and its growth, the change in the health sector with our colleagues who work in the countries where implementation is actually taking place. Most of our panelists are leaders. They're in leadership position, and they're referred to as they're the so-called local practitioners, right? In the countries where implementation is actually happening. So we want to learn from them about their viewpoint on capacity development, particularly on potential misconceptions that international practitioners may hold in whether it's prescribing, designing, or recommending solutions and approaches that may or may not yield the desired results. So we'll also talk today about what the future holds for greater indigenous representation and the extent to which sort of the latest donor guidance meets the needs of local actors to build a more resilient and prosperous health system for use by all of its constituents. So with that, I'll sort of talk to you a little bit about what the structure of the panel, what it looks like, what we can expect in our discussion today. So the panel discussion will be split into 3 parts, and the first of those will be a series of lightning talks. So I will ask some guiding questions to start off the discussion, and each panelist will speak for approximately about 4 minutes, responding sort of in a way that they would like to, drawing from their rich sort of experience and expertise. The second part will be moderated Q&A, question and answer session. I'll ask follow-up questions so that we can go a little bit deeper into the responses that our panelists have given. And the third part will be open question and answer session, where we'll be taking questions from the audience. So please use the chat box to provide comments and ask your questions. We'd love to hear from you. We appreciate you all taking the time to join us today. So without further ado, I'll go ahead and introduce our distinguished panel, starting with Ms. Nozipo Nkachwa, who's a child protection professional with over 25 years experience working in community development, HIV and AIDS, children and women's issues in Eswatini. In previous roles with the National Emergency Response Council on HIV and AIDS, which is the Eswatini National AIDS Council, Ms. Nkachwa provided leadership in the National OVC response in line with the National HIV and AIDS Strategic Framework. She has advocated for Eswatini to maintain social protection in the national HIV response and has facilitated the writing of the social protections in 3 national HIV and AIDS strategic frameworks. In 2020, she joined Young Heroes, a local NGO, as project director for the USAID-funded Dreams in OVC project. Our next panelist is Dr. Salsa Majali. Dr. Majali currently serves as a senior advisor, health system strengthening on the USAID Health Systems Quality Accelerator activity in Jordan. Dr. Majali has a wealth of experience, previously serving as a senator in the Jordanian Senate, as the Secretary General of the Higher Population Council, as the director for the Queen Zain Al Sharaf Institute for Development, ZANID, and she was also formerly the director of nursing, the nursing program in Dar Al Hekma College and vice dean of students in Jeddah, Saudi Arabia. So she is also a previous faculty member at the University of Jordan Nursing College as well. So she has served as a consultant to multiple donors, to multiple donor agencies working in Jordan and Saudi Arabia. And Dr. Majali holds a PhD in nursing from the University of Michigan in Ann Arbor. Our next panelist is Dr. Fred Semitala. Dr. Semitala is the Executive Director for the Makerere University Joint AIDS Program and a Senior Lecturer at the Department of Internal Medicine at Makerere University College of Health Sciences in Uganda. He's a physician and public health specialist with over 20 years of HIV and TB care and programming experience, as well as implementation research and capacity building. His research focuses on integration of evidence-based interventions into programs to improve outcomes for HIV and HIV-related comorbidities. Our next panelist is Dr. Ghassan Karem. And Dr. Ghassan is the General Director of the Primary Healthcare Institute at the Ministry of Health in Libya. He's a medical doctor with a master's degree in public health that was supported by IRC through funding from the European Union. He's supervising and facilitating the implementation of all the PHC projects in the country and has a strong collaboration with UN agencies, the World Bank, INGOs, and donors as well. Last but not least is Dr. Nneka Orji. Dr. Orji is a UHC advocate with a wealth of experience as well, committed to improving healthcare delivery in resource-constrained settings as a clinician. She's a medical doctor with extensive experience in rural areas and underserved communities. She has also worked as a policymaker in Nigeria's health system for over 15 years, where she initiated, supervised, and implemented a number of projects, a number of projects, excuse me. Dr. Orji also served as a technical advisor to the Ministry of State for Health in Nigeria, while also serving as the lead health economist at the Federal Ministry of Health in Nigeria. She is currently enrolled for a PhD at the Mengi's School of Medical Research at the University of Tasmania, where she's working on the epidemiology and health economics of myalgic encephalomyelitis or chronic fatigue syndrome. She's a recipient of the Australian Awards, the Africa Scholarship, the Australian Awards in the Africa Scholarship, and the Medical Research Future Fund. So please give a warm welcome to our panel. As you can see, their experiences are very, very detailed and very deep. So welcome to the panel. It's a pleasure to speak with you all today. So before we start, as I mentioned, the panel will be, will be a series of sort of 4-minute conversations, lightning talks. I'll just provide sort of a framework of questions that you can then sort of respond to as you would like. So I think in our 4 minutes, we'd expect to hear from our panel about sort of the sector and the program that they work in. We've done sort of a detailed introduction, but we'd welcome any sort of additional details or information that they would like to share with us. If they can also describe, if you can describe your experience with local capacity development with international organization and donors as well. And, we're keen to hear from you, from your experience, what type of approaches best work to support health actors to strengthen the quality and reach of health programs, and what changes you would want to see in how donors and international organizations approach capacity building. Finally, we hope that you'll also share with us or provide any feedback, if you have any, on how to operationalize policies on capacity sharing. And we use capacity sharing, again, because there's a fundamental assumption that there is capacity both in the global north and the global south. So it's about sharing that capacity amongst international organization, donors, and health actors, both at the national and the subnational level. So with that, I'll just hand over to Ms. Mkachwa to maybe start us off with sort of our 4 minutes. Over to you.
Thank you, Program Director. I don't know if my okay. Okay, I'll be talking about our experience as young heroes in Swaziland. Our local capacity learning as we were transitioning from a small NGO, national NGO, into a prime partner of USAID. We received assistance, capacity building from PACT, which is an international NGO. Next slide, please. So Young Heroes, let me just contextualize who Young Heroes is. Young Heroes is a local registered NGO in Eswatini. It started operating in February 2006, and it was born at a time when the number of orphans was increasing in the country due to AIDS, and there was an absence of actors to provide them with basic services. So Young Heroes came in as one of the NGOs that were born at the time to provide for our OVC, and we set out our mission, which was to empower Eswati's vulnerable youth. We provide our orphans with monthly life support grants, economic empowerment, vocational skills and training and empowerment. And then we have some social protection services, which include birth registration, psychosocial support, education support, and parenting skills for our caregivers. And then we've got comprehensive healthcare for our OVCs. And we also provide some gender-based violence education and prevention and HIV prevention education services. But basically, when we work, we aim to help our children to grow successfully into self-reliant, self-sufficient, and healthy adults. So currently, we're implementing a 3-year PEPFAR funded program on HIV prevention and HIV mitigation. Our project beneficiaries are OVC aged 0 to 17 years with their caregivers, and adolescent girls and young women aged 10 to 29 years old. Next slide, please. What was our experience as a local partner? We were identified in Q4 of 2019 as a potential local prime partner by PACT after a 5-year relationship as an implementing partner for an OVC program. And then from there, PACT provided us with an enhanced technical assistance support to ensure that we were prime ready and we could receive funding from the USAID. And both PACT and Young Heroes jointly developed a transition readiness plan whose main objective was to identify and track key elements for the organizational development and programmatic performance of Young Heroes. PACT provided the support for also the proposal preparation up to submission to the USAID. And Young Heroes was then awarded a fixed amount award in December 2020. And PACT also then provided ongoing support for the first year of implementation. And this was on technical guidance and reporting to the USAID just to ensure that both financial and narratives are to the quality. Next slide, please. What worked well? Assessment preparation. Okay, the stages of assessment preparation. In terms of the assessments, PACT performed the organizational development frameworks. These included their internal documents, which is the ITOCA and the OPI, and then also provided us with USAID NUPAS assessment. But we did a mock assessment just to check on readiness. The aim basically was to identify potential issues and address this before the actual NUPAS that was to be provided by the USAID, and thereby also reduce our pre-award conditions. Both Young Heroes and PACT developed a work plan to address the identified weaknesses before the actual NUPAS. And during this time, there was intense capacity development from PACT for the finance team. And we were introduced to the webinars to further capacitate us on the areas of rules and regulations to ensure that we were ready. And for the programmatic weaknesses, we identified targets, and PACT would then provide weekly check-ins to make follow-ups and ensure that we were addressing our programmatic weaknesses. And such that by the time we did the NUPAS, we received favorable results without any conditions. Next slide, please. In terms of proposal development, what went well? This, like I said, Young Heroes was a small organization at the time. There was a lot of capacity that needed to go in, including even writing proposals to the level of USAID. So in the proposal development stage, the turnaround time for the proposal was too short. So PACT was able to give us the necessary information and work to be done in advance, especially report for the proposal. We just only focused on writing instead of collecting documents and hiring staff. All that we did in advance. And then in terms of proposal conceptualization, we know that there are lots of technical terms that come with the RFA, and this needed to be unpacked and packed using in their headquarters in the US. Were able to provide us with technical assistance to understand the RFA, and including the comprehensive program coverage that we could do. In writing the proposal, by that time, most of our key personnel was not on board. So our proposal writing team was a bit weakened. So we did set up a proposal writing team, but because it was weakened, PACT supported us to review the document and to ensure that it met USAID quality standards. And also for staffing,
Nozipo, can I please ask you to wrap up? We're just at the end of the 4 minutes. So I just wanted to kind of fight for you.
It's only one more slide. Okay, and then to ensure that we had the right key personnel on board, PAC set in our were panelists to identify the required skill. Last slide, please. So in terms of what are we proposing as changes, for the transition readiness plan, I would really suggest that change management be put in as a milestone and considered, because there are lots of changes that the organization needs to go through. The changes from program-based to results-based reporting from the USAID, and so some staff have to be assisted to understand the changes and to minimize the tensions, given our the mix of skill sets in the staff. And then also lastly, for the proposal process, like a small NGO, we don't have funding to do extra work. So if it can be considered to give additional funding for the proposal stages, I thank you.
Great, thank you so much, Nozipo, for that detailed presentation. I just wanted to acknowledge Dr. Gassam, who has basically made a lot of sacrifices to be here with us today. He's actually joining us from the road. So Dr. Gassam, can I just hand over to you to kind of just sort of share your experience with local capacity development, and thank you again for taking the time to join us.
Thank you so much, Chairman. Thank you so much. First of all, I want just to make sure that my voice is clear. Is it clear?
Loud and clear.
That's fine. I'm so honored to be part of this discussion. And sorry for the small inconvenience because of the time zone, and maybe I didn't pick up the right time. So thank you so much for this. And I think it's a very important concern to every decision maker, either in a governmental or non-governmental institute. And capacity building is a very important area. So here I want to focus a bit my speech on how to make sustainable changes and how to, let's say, design or implement sustainable interventions, because I know many non-governmental organizations, they would like to implement projects, but they would like also to see sustainable changes on the intermediate and on the long run in terms of impact, in terms of outcomes. So I will share from my experience, let's say in Libya, with many national and international NGOs, including UN agencies. I think it's mainly about two main points. First one is the ownership, and second one is the existing system. So if you want to see sustainability, sustainable intervention, continuous results in any project, please make sure that you are taking care of the national ownership. And that can be ensured by participation. Not participation in late stages. You cannot, you design the project, you do the needs assessment, you have your plan, and then you invite everyone to say, okay, this is a launching workshop, we have this evidence, we have this plan, we want to implement this project, this is our goals, what do you think about it? This is too late. If you want a real ownership, a real partnership, you need to engage them since day one. You need to engage the national staff, the national authorities at national level, at subnational level, at local level, the local communities, you engage them since day one, since step one. It needs assessment. You need to engage them during planning. You need to engage them to design the implementation, during the implementation, during the assessment, the evaluation, the monitoring process. By this, you could guarantee their participation. You could guarantee that they will feel that they own this project. It's not only your project as an agency, but it's the project of them as well. And you need to give them the sense that they have the responsibility to lead, not only to participate, because at the end they are responsible and they are accountable to their people. So by this, you could ensure sustainable changes. But if you exclude them, or let's say if you don't engage them in a good way, by the end of the project, we will go back to square zero, because they will feel that this is your project. It's funded by an, let's say, a donor, international donor, implemented by international agency. So we don't have to do anything about it. And when the project is over, everything is over. And those people, beneficiaries who got used to the project, who has got or who have got benefits from the project, all of them, they will find themselves that they were, let's say, those benefits were taken and they were over by the end of the project. And it's not good for, let's say, sustainability, but also for the reputation of any agency, and also the most important for the end users, because they are the target. And then the second point is using the existing systems. I know this is difficult, especially when we're talking about a situation or a context like what happened in my country or any post-conflict situation. When you want to interfere quickly, when you want to reach the end users in a fast way, when you want to provide services because you are in an emergency situation or emergency context, I know sometimes you have to bypass the existing systems because they are so bureaucratic, because of the fragility, because of many complications, yeah? But you could reach the end users quickly, but it will not be sustainable, I promise you, because I've been part of many projects. But if you want to have sustainable intervention, if you want to have sustainable impact, then you need to work through the existing systems. You need to think about how to support the existing system. And at the same time, when you are thinking about how to respond in emergency situation, yes, you can use fast track channels to implement quickly to save lives. But at the same time, do not overlook, do not ignore the existing systems, because only by this way, you could have sustainable changes, because strengthening the existing systems and working through them will ensure sustainability, not only including people, because I was talking in my first point about engagement of national, let's say, personnel to ensure the national ownership. But it's not only enough to engage and to include and involve individuals. You need to work through national institutions. If you are designing and you want to implement training program, let's say, so you need to check within this country or within this region or this municipality, what institution responsible for training, we need to engage them. So by this, we can ensure that after the project, they will keep train people using the same materials, because we use the project maybe to strengthen them, to support their capacity, to give them the tools, to help them to develop the materials, to develop maybe trainers through TOT sessions or so. But we will ensure that they will use our materials and they will continue training people, and we will see that the impact of our project continue even after the deadline of the project. And I think by these 2 points, it's very important that we ensure sustainability. So I'm not only talking about training institutions, but whatever institution you needed to do according to the activities included in your project, like procurement, service provision, even media and communication. So you need to check the local, the national institutions, entities that are responsible for these functions, and you engage them in your project and you try to work through them. I know this is slow. This is very hard. It's not easy. especially when they don't have the capacity, but that's the point. And sorry for taking too much time.
No, no problems at all. Thank you so much. I think that's a really
Thank you so
important
much.
point. It's a focus on sustainability and making sure that we engage, sort of the relevant bodies, the relevant authorities, because, after all of these, sort of individual projects have been completed, effectively what we have left are those, sort of bodies still running. So we need to make sure that we can actually sustain what has been started. So thank you so much for that, Dr. Gassam. I'll just hand over next now to Dr. Nneka Orji, just to share with us, from her perspective as well, sort of what approaches have worked best, or, any kind of feedback, and what changes that, potentially you'd like to see, and any additional things that you'd like to share. Over to you, Nneka.
Thank you very much, Olivier. And thanks to the team for putting this discussion together. I think this is also coming at a very good time, especially with some of the key learnings from the pandemic intervention that has happened across countries. So for us, we think that we could work better if we start imbibing the culture of open and mutual accountability with in-country stakeholders. What do I mean by this? In contextualizing the interventions or the support, bringing critical stakeholders together to co-create the strategies instead of handing down or being prescriptive in the strategy. For us, that has worked a lot for us in Nigeria, when we would sit to collectively identify these problems. We know that these problems do exist, so we know how we want to have them being addressed, rather than getting already made up plans that may not technically work for the existing system. Dr. Gassam spoke extensively on using existing systems. This is very important, especially when you have diverse stakeholders with diverse interests. It is important that each of the stakeholders are adequately and deliberately engaged, such that inclusivity is achieved, because if everybody is not included in the conversation and their interests are not aligning or are not aligned with, it could create a lot of setback. And most importantly, having a feedback mechanism that is co-created by every stakeholder, it's also very important. You can't have a system or intervention where you're just imputing without having to get feedback from the consumers of the intervention at every point in time. So that is also important, such that you can also have room for making adjustments when necessary and when necessary. So that has also worked well for us back home. Again, I think with partners or funders being open with what they are imputing into the system in terms of the strategies they want to adopt, in terms of the funding, the investments they want to make, that's also very important if really we want to address issues around open and mutual accountability. And in conceptualizing the interventions, strategies for sustainability is also very important, because sometimes these interventions or capacity building strategies are brought to the table, but no provision for sustaining already built capacities or already built strategies. And then when the partners leave, what they have brought lives with them. So it is important that the local and critical stakeholders are adequately engaged and communicated with, such that the system does not just have a half benefit, but full benefit that can be sustained over time, and of course ensuring full system strengthening and system building for the system. So these are some of the strategies and how we have worked with some of our partners in Nigeria, and that has really worked with us. Thank you very much, Olumide and the team, for giving me the opportunity to share some of our experiences from Nigeria. Over.
Thank you so much, Nneka. And I think, just to recap, I think your point about open and mutual accountability is really critical. I think we talk about strategies for sustainability, again, which we heard from Dr. Gassam. And I think that concept of making sure that there is open and mutual accountability is really important. Sometimes I think we see that, accountability is sort of a one-way street, right? So I think making sure that our whether it's NGOs or the donors are actually accountable to the countries that they're working, I think is also really important. So thank you for those really important points. For those of you just joining us, we are talking about local perspectives in capacity development within the health sector, the global health sector. And we've heard from our colleagues, Ms. Mkatra Nozipo from Eswatini. We've heard from Dr. Gassam from the Ministry of Health in Libya, and we just heard from Dr. Nneka Orji, who is representing the Nigeria perspective, but is actually currently located in Australia. So thank you all for taking the time to join us, and thank you for those really brilliant and really insightful perspectives. Next, now we'll hear from Dr. Fred Semitala, from Uganda, just about his perspective and his experience around sort of local capacity development and what we can do to, to sort of improve, and how we can sort of communicate better to share, sort of accountability amongst international donors and organizations. Over to you, Fred.
Thank you, Olumide, for moderating this discussion, and thank you, SID, for inviting us for this very interesting topic. As introduced, Fred Semitala, and I work both with a university teaching hospital, and also I lead an organization which actually belongs to Makerere University. And the program that I lead as the executive director is largely funded by PEPFAR to deliver comprehensive HIV services, but also we provide technical assistance to our partners. And also, being a university institution, we build or strengthen capacity for trainees, both at undergraduate, postgraduate, but also PhD levels. And so from that background, I will share my experience into maybe two perspectives. One as an academic. I think when you are looking at capacity building in an academic fashion, I think it's more straightforward. It's really supporting an individual to develop competencies. For example, as a physician, being able to identify and manage medical conditions at advancing levels. I think that is easier. Because after that, it is then incumbent upon the trained person to be able to translate those skills and the knowledge that is acquired to their targeted audience, which are often people who are suffering from different ailments. The other perspective is research, but also maybe programming. As I've mentioned, we do comprehensive services. My experience from that perspective is that many times this happens as a result. So normally what happens is that there is a funding opportunity that is advertised, where the do's and don'ts are clearly defined within the request for application. And then the local partners' responsibility is to make sure that you strive to fit within those prescribed requirements. So in that case, if I'm looking at the capacity building, maybe it's less likely to be assessed from a perspective of how far I've moved in terms of being able to address the needs of my community, and more towards how much of the intended goals of the projects am I able to achieve. So, so I think my desire would be to look at some kind of engagement where the partner is positively engaged, and also that where we have the requirements of these programs well aligned with the priorities of the actors, in line with the purpose of the program, so that there is shared partnership, shared planning. So in a way, you can have an opportunity to discuss the long-term plans, and also you also agree upon the deliverables of the program. I think that promotes sustainability. But also the other thing that I see that needs to be, I think, working from the area of HIV, we have learned that I think populations in need could appear like a large group, but when you get deep in there, you see that there are different levels. For example, the women, the children, and the other stakeholders might have their unique needs. And unless one goes down to the partners to discuss those in details, it's difficult that we'll come up with a sustainable program that will address all their needs. What I would love to see improved is the ability, and I think it has been mentioned by one of the speakers, the earlier speakers, the need to recognize existing capacity and strengthen it to meet the community needs. If you don't look at that and use it to the advantage of the intended program, it will be less likely to attract a sustained commitment to the larger goals of the program. And as a faculty at the university and as a program leader, I always wish to use a terminology like capacity strengthening as opposed to capacity development, because when you are strengthening, already you are assuming that there is some level of capacity within the entity or within the actors that you're working with, as opposed to capacity development and capacity building, which in some ways connotes starting from a level of no availability of capacity. In the interest of time, I think that's what I can talk about. That maybe we'll have some more discussions later. Thank you.
Thank you so much, Fred. That's for those great points. And you know, I think again that the spirit. I think the last thing that you mentioned is in the spirit of this particular panel, which is making sure that we talk about capacity, whether it's capacity strengthening or capacity sharing, rather than the assumption of an inherent lack of capacity. So thank you so much. Dr. Sasa Majali, can I sort of invite you, please, to share with us your perspectives from your rich and diverse experience, just your thoughts on the capacity development conversation from the perspective of the so-called local practitioners. Over to you.
Thank you very much. I'm a co-founder of a non-profit company called Tillman, and we work on women empowerment, youth empowerment. We've worked on child protection. We've worked in terms of the justice sector. We have worked with several, UN and international donors such as UNICEF on capacity building for NGOs related to child protection. We have worked with Plan International on jobs, empowering youth and training them on various jobs. We've worked on food security somehow by training families on how to plant their rooftops in a refugee camp so that they have food supplies at home. We've also worked on women and youth economic employment and empowerment through agritourism. So we've established a farm and we were able to employ women with the moringa tree. It's rare in Jordan, so this is a new venture of producing moringa leaves and selling the products and employing the women. We have also worked on juvenile justice through alternative measures. And at present, we are working with USAID on a newly launched activity, which is called Health Systems Quality Accelerator, that is being carried out by URC, University Research Company. So related to reproductive, maternal, and neonatal and child health. So it's a wide variety of organizations that we've dealt with. And the approaches that I think work best is, and my colleagues have talked about that before, the idea of the participatory approach. And as they pointed out, participation doesn't start when everything is ready and you just want to tell people what you want them to do. It has to start from identifying the issue and then in putting the plan and implementing it, and even in evaluating the results, whether this is working or not. And the participatory approach should not be just at the high level with the officials and the authorities. It should be with the local communities where we are applying these kinds of activities. So that's one big thing. In terms of healthcare, I think it's very important that the health centers reach out to the community where they work. A lot of times, even though they are based in a community, but somehow they do not interact with that community. They do not bring them to the table and work with them in identifying the problems, but also coming up with solutions. And I think that leads to the feeling in the community that they don't own this health center, and that it is anything that goes on has to come from the center. So the idea that even the government or donors have to think in a decentralized way. The government has to implement decentralization in its decision-making and empower local communities, local leaders, health centers and healthcare providers to take decisions at that level. And also the local communities should be a very active partner in, as we said, all stages or phases of any kind of activity that is funded by the donor. The other point is we need to have an accountability mechanism in place, because a lot of times international projects come, they are there for 4 or 5 years. And as my colleagues have said, they come, they do their bit, they have their numbers, they have their guidelines, they have their products and leave. So there needs to be an accountability system in place to hold the local authorities, the local counterparts accountable for these projects. I don't just hold the donor accountable, but I hold the authorities who worked closely with the donor in implementing the plan, that they need to have ownership of these products. They need to take them and sustain them and continue to use them, or it's money down the drain. The 5 years go, and if there's no continuity, we go back to zero with the coming project. The other thing is what might help also is having looking at our legislation, whether it's laws, whether it's regulations, whether it's guides or whatever. We need to look at them and see whether we need to revise them, to update them, so that they can emphasize the need for implementing the outcomes of these projects, whether, as you had said, capacity development or implementing guidelines or any kind of activity that has been implemented by this project. The other thing is making sure of the quality of the people who provide the capacity development. And that's really an important point. It is not just, yeah, we want to benefit these, or the ministry insists that their trainees come from them. We need to choose competent, qualified people who not only have the knowledge, but the practical experience to train people. We need to make sure that resources are there for people to train, but also later on to implement. If we put them in a very ideal situation and they go to the field where they don't have these resources, then we're going to fail. So that's very important. And in terms of what do I want to change, I think we'd like to see more bottom-up approach from the donors. A lot of times these projects, proposals are developed in Europe, in the States, very far away and isolated from the reality of the country. It is basically made based on a desk review of the country and really no realistic data or information or experience from the country that they are going to work with. The other thing, as we said, is that we need to look at the local community. We need to empower the local NGOs, because they could be the ones that hold the authorities accountable. They could be the ones who sustain activities, and they need to be also part of the participatory approach of identifying the issue, putting the solutions, and implementing them. And as my colleague said, we need, when donors come, to build sustainability in their actions from day one, meaning the language of sustainability has to start from when I start putting the proposal till I put my work plan, and when I start my activities. Sustainability has to be on my mind all the time, so that whatever good work this project is doing, it will be sustained later on. And this is really very important, whether it is, as I said, training local trainers, making sure there's a training entity or some kind of structure in the local authority or in the ministry or in an organization that will be willing to work with the ministry later on. That is very, very important. The guidelines and so on, we need to have them in a place where people can access them and not just hidden somewhere in a storeroom after the project finishes. Establishing electronic platforms is a very good idea, because then these can be more accessible to people. And one thing is, a lot of times we build guidelines and things like that, but we have launches and big celebrations, but very rarely other health sector or healthcare providers are knowledgeable. So there needs to be a dissemination plan and a scale-up plan for whatever these projects do. I'm sorry I took time, but I'm looking forward to our discussion. Thank you.
Great, thank you so much, Dr. Majali. No, thank you. I just wanted to kind of maybe just do a quick recap in terms of the themes that we heard. I think, you mentioned a number of things there that we've heard from our colleagues as well around, ownership and true ownership. So country ownership, making sure that sustainability planning, starts at the beginning of these projects rather than, when things have already been designed. We heard something around open and mutual accountability, which I think is a really important one that we've heard from you as well, Dr. Majali, and we heard from NECA as well. So, I heard sort of a theme around decentralization as well, sort of from you, and leveraging and using sort of electronic platforms. So maybe with, just the next phase of conversation, just kind of the moderated question and answer, maybe we start with with a question around how we can make, sort of capacity strengthening, to use Fred's words, capacity strengthening as a true partnership that's rooted in an exchange of ideas, knowledge, experience, and planning, because we often talk about, it seems that at least from everybody who we've been talking to today, our panelists have very clear ideas in terms of how this should be done, and basically what we should be planning for in terms of sustainability. So the question is the how. So maybe we can start with Nneka, and then we can go to Nozipo in terms of just answering that question. Please, so Nneka, please, over to you.
Yes, so thank you very much, Olumide. And thank you to all of the panelists for the very beautiful ideas that we've all been bringing to the table. So I think I want to ride on one of the key points that has been made, which centers around, is it capacity building or capacity strengthening? Because this is very important. In most of our settings, you find out that, look, these capacities actually do exist. But the question is, if we have a critical mass, to ensure that sustainability is guaranteed. So using those existing capacities to further strengthen and build a critical mass for sustainability and, other gains is very critical, and it's one of the approaches that I think we can look at more closely instead of having to reinvent the wheel. So we need to do that needs assessment to be able to ascertain what level of need actually there is, and looking at how to leverage what is existing to ensure that we build a critical mass to be able to achieve the desired target, instead of bringing in new ideas or new capacities that may not really be tailored for that environment. And again, the issue of trying to really identify who is building whose capacity, and whoever is building the capacity will also need to take a more critical look at what's the capacity of the person. So this also brings again to the table the issue of being accountable. This person that we're bringing, what exactly is the level of expertise that this person is bringing to the table? So that is also very important. So the conversation with the local stakeholders is very important, and having that in-depth conversation should be able to bring out all of these, in terms of identifying what the needs are exactly, and to what extent, these gaps do exist, and what can be leveraged from inward to be able to address this gap. So all of these are very critical areas that could be considered and looked at more in-depthly to run with. Thank you, and over.
Thank you so much, Nneka. I think that's a really interesting point, around, I think that, again, I think around making sure that, we don't reinvent the wheel, but I think more crucially as well is the capacity builder, right? What capacity does that, whether it's institution or organization or individual, actually have, and what are they bringing to the table? So I think what you might be suggesting is understanding what capacity exists, what the gaps needed are, and making sure that you actually create a situation where you're matching, right, the capacity that needs to be strengthened with the capacity builders' expertise and inherent, I guess, not to sort of flog the word, but capacity, right? So I think that's it's a very important point. And I think oftentimes we do see a situation where, there may be more existing capacity, in sort of the sort of organization that may need to be strengthened than in the strengthening organization. So maybe I'll just hand over to Nozipo and say, just along those terms as well, Hello?
Sorry, I didn't get the last part of your yeah.
Sorry about
Something
that. Yes,
happened with my
I was saying
internet.
based on, no worries at all. Can you hear me okay now?
Yes, I can hear you.
Right. So I was saying, based on your experience with, with PACS, in terms of local capacity development, is there any way that you would define, sort of local or capacity development in a different way, but also kind of understanding how we get to a situation or to a position where we're talking about a true partnership rather than sort of a vertical kind of, I guess, cascading of capacity development, as it were.
Okay, I think with our experience with PAC, like I had said that we had looked at it followed numerous assessments, and so we should do the joint plan together, and we did look at our national capacity and we did try, the outcome we were looking at was the national capacity and local ownership to achieve the sustainable outcomes. Our strategy was using the performance improvement strategy, and monitoring this on a regular basis. But I think like I was saying earlier is that, you move, the move is so fast to going from what you are used to this results-based. It's a whole approach, a whole different culture altogether that you have to move into. And if you when you're in a small environment, it needs to be managed with a lot of how to change management, and even as the part, so that PACT used to be we were sub-granted by PACT. So even the changing in the relationship, before they had power, we were just receiving. So how do we even change this balance of scales? So those were things that I think we should always look into. That's why I was really advocating for the change management for both the international NGO and the local partner. So that would be my my input to this. Thank you.
Thank you so much, Noziko. I wanted to maybe just turn over to Dr. Gassam. You talked about sustainability and working, working with the actors and the institutions that already exist on the ground. But you also mentioned that there are some times where, whether it's because of a crisis or something that's going on in a particular country, that, these systems need to be bypassed. So I just wondered, is there anything that, you want to share with the group that you have, based on your experience? It's important to know about maybe some experience that you've had, or your country where you currently work, that would be important in achieving sustained results and that sustainability that you speak of, but may not necessarily always be in the sort of public or global discourse.
Thank you so much, Chairman. And yes, first of all, let me thank even my colleagues for their informative contributions. I'm finding myself today that I'm learning a lot from everyone. Thank you for that. So I will elaborate more using three main aspects. First of all, please, everybody, keep in mind that capacity building is not limited to training. It's not only about training, because what I see in many projects, capacity building means training sessions, training workshops, POTs, cascade training. It's not only about that. It's about how to create environment where those people can work and produce and improve. It's about how to support the system within which they do work. It's about how to provide them the tools to improve their performance. It's about how to support them with materials. That's how to develop or improve their job descriptions, the legislations and policies that organize those group of people or employees or health workers. So it's not only about training. This is the first point. This is the main fact. Then the second one is, please keep in mind that when you want to implement any capacity building program, take into consideration cultural issues like the national values, because sometimes you are targeting a sensitive subject. And if you use the wrong approach, there will be misunderstandings, especially when we're talking about, for instance, family planning or gender-based violence, or let's say women and youth empowerment. They are very important areas, very important. But if you approach them in the wrong way, you will find resistance. You will find that people misunderstood you. They will not support you. Maybe they will resist your intervention. So you need to find the cross-cutting areas, the common areas between those goals, those targets, activities, interventions, and the national values. You will find so many common, let's say, and cross-cutting issues. You need to use them. So you need to talk about things and you need to implement interventions from, let's say, national values perspectives. You need to respect that because it's sensitive to people. And then the third point is the context. Like for instance, let's say in a post-conflict context, there are some challenges, like for instance, frequent turnover of governments and government officials. Every 6 months to 1 year, you will find a new government, new directors, new prime minister, new minister of health. And then you will not feel stable or sustainable. And you need to repeat like everything from square zero, from the first step. And how to beat this? You can do that when you connect yourself very well to the technical people, to the middle management level, to the head of programs, or those who are working at the technical level, not at the policy making level, or let's say the decision makers, because they are very, very, very changeable. They are not stable. There is frequent turnover at the level of the, let's say, ministers, especially, and governments in post-conflict situations. That's why you need to connect yourself better to those at the technical level, those who are engaged within the implementation, and use them. Because like when there is any new leaders are coming, when they find their technical staff aware about the project, aware about the intervention part of it, and supporting it, this will help you to implement successfully. This will help you to continue, let's say, making your project and your intervention a successful intervention. And you can then build up your project, or mobilize more resources, or expand it, or you extend your activities to other, let's say, locations or areas or whatever. So those were my main 3 points that I thought it's very important to share with you, because I have seen that years and years, more than once, like over and over in my country. And I think it's not limited to my country, but also it's happening even in other countries. Over to you, Chairman. Thank you so much.
Thank you so much, Dr. Gassam. I think those are really, really important points around, sort of national values and the change in government. I think that working, again, and offering the solutions as well. So thank you for articulating the problem, and also, offering, solutions as to how we can move forward. I think we've had a really sort of rich discussion here, and I just wanted to maybe, just maybe start with Fred, and then we'll go to, or actually start with Dr. Salsan and then go to Fred around. So I just wanted to ask this question. We've talked, I think in the introductions, we talked about the decolonization of, aid, and we have talked extensively here around sort of sustainability, and basically just making sure that, we have tailored solutions, which requires understanding, again, national values, the culture of the people that we're talking to, and, making sure that we're also working with the right agencies within the country. So just in, aligning with sort of the theme of decolonization of aid, do you want to maybe sort of share with us your thoughts around how that, decolonization of aid factors into capacity building or capacity development or capacity strengthening, and how we can, sort of either, whether potentially use that as a lever, but also make sure that we are taking into account the concept of capacity when we are talking about, sort of decolonizing aid as well, and how, one can contribute to the other.
Thank you for that question. In Jordan, we have 2 forums. One is called the Jordan International NGO Forum, and it is a forum that gathers all international NGOs working in Jordan, because, during the Syrian crisis, a lot of the NGOs came, international NGOs came and started working on various humanitarian aspects during the Syrian crisis. And at what point in time, I think Jordan had the largest numbers of international NGOs in the world. At the same time, the local humanitarian NGOs established a forum called JONAF. And because we found that we were foreigners in our own country, meaning that the international NGOs came into the country and took over the humanitarian relief without really involving the local NGOs. And so as if we were pushed aside, that created really an issue because number one, some of the funding that was coming to these local NGOs was diverted to the Syrian crisis. And if these local NGOs worked with the international NGOs, they would get pittance from the funding and it would barely cover an activity. No overhead, no support in terms of administrative staff, rent, and things like that. And that was an issue. The other thing was that Syrians are, we consider them, they are our cousins. We are all Arabs, we all speak the same language. We have a lot of relationships, family relationships, trade, and so on. And we knew their background, what they think, and so on. So we could have added to the humanitarian support in knowing how to handle the Syrian crisis. So we found that we were put aside, and these NGOs were coming, hiring some Jordanians, but they came with their agendas, with their proposals that they had written and submitted. So it was really not an easy time. Some work has been done in Jordan to support localization of funding. And I think that is an important thing, is that there was a mandate or a new directive that came out of the Grand Bargain Conference, in which that a certain percentage of funding should go to support local organizations. And that is important. We saw millions and millions coming into organizations, the international ones, and yet there was little effect on the local NGOs, which we think are more in the field, they're more down to earth, and they know the local context. So I just wanted to bring that up as an issue, especially in places where there is crisis. And then when the money started becoming less for the Syrian crisis, suddenly you found these NGOs closing up and leaving. And a lot of times this is a problem, because where is the continuity? Where is the sustainability of the work that they are doing? And we know that Jordan comes up with, every year with the UN organizations on what we call a Jordan response plan, how to deal with the Syrian refugees, but also to support local communities which are hosting these refugees. And even though there are a lot of commitments made, but they are not really coming to reality. And so who carries the brunt of this? It is the Jordanian government and the Jordanian people. So that is part of what I think goes with colonization. I think when international donors come to the country, they have to work with the local people. They need to build the capacity of their own staff, because a lot of time what we see is the international organizations draw talented staff from the local NGOs. So the local NGOs lose these talented people because they can't pay their salaries, the competitive salaries that are provided by the international NGOs. So one thing I think the international donors need to do is build the capacity of the locals, rather than this unethical recruitment and depriving local NGOs or local authorities, the government even, of these people who have these talents. So that's one of the issues. As we said, we need to have in place legislation in order to enforce whatever has come out of these projects. Donors need to be held accountable, but also, as I said, local authorities need to be held accountable. And we need to make sure that after these projects finish, the accountability remains. What have you done? Where have these resources gone? How have you scaled this up, and so on? One thing that I think works well is that when the government adds items in its budgets that support the outcomes of these projects or the donor activities. Because without funding that has been designated by the government, we will just keep waiting for another donor to come to support these. And if they don't come, then these positive changes will disappear. So I think we need legislation, we need budgets in place in order for us to ensure that this international funding is sustained, it will make a difference in people's lives, and it will be scaled up more. So I don't know if I've answered your question, but I think that's my take on things. Thank you.
Thank you so much, Dr. Majali. I think you gave us, you did answer the question, and you gave us a lot to, to sort of think about as well. And I think these are issues that I'm sure that if we were to, check in with our other panelists, I'm sure that they see across the countries that they work as well. So thank you so much for that very frank, sort of assessment. If I can just maybe, finally, but lastly but not least, to Fred, to maybe sort of give his perspective on that question as well around sort of the intersection of decolonization of aid and capacity strengthening. Just to share some final thoughts. Over to you, Fred.
Yeah, thank you very much, Olumide, and thank you, Susan, for those very impressive remarks and quite on target. I think the other small addition I can make is that I think NGOs or international organizations, as they come into these other countries, in addition to working with the governments and holding them, coming up with a clear shared plan and a sustainable plan. One of those, in addition to making sure that the people who already have capacity are not completely taken away from the local organizations, I think there should be a deliberate effort to, to develop a plan for coming up with a pipeline. From the academic side of my life, I can show that, for example, in the university where I teach, some of the people who taught me have actually moved on into retirement and others have passed on. But because there is a deliberate effort to train others into trainers, here I am as a senior lecturer, soon to become maybe an associate professor. But as I do that, there must be some other people who are at the level of assistant lecturers, and then become senior lecturers. And so even with these programs, there must be a deliberate effort to build that pipeline of, so that even when there is a change of government or change of leadership, then there is a pipeline from which people with a shared goals, shared vision, can be able to assume the additional leadership roles so that we can be able to move to the shared goals that could have been developed. But that all can only happen if there is a shared plan with the local players. I think these short interval programs of 5 years, 3 years, 2 years cannot in any way develop sustainable developments. I think that's my quick take to decolonization. Thank you.
Excuse me. Oh, can you hear me?
Yes.
Wonderful. So yeah, no, thank you all so much. For such a rich discussion and very, very important discussions as well. And just to sort of reiterate the themes that we saw around sort of, open and mutual accountability, capacity strengthening, sustainability, decentralization, and, sort of ensuring ethical recruitment as well, as well as sort of leveraging local capacity and not, sort of just having sort of folks, sort of parachute in and parachute out. We had talked about a third, sort of section of this, which was going to be audience participation, but since we hadn't received any questions, so we kind of, sort of continued that discussion in terms of the conversation and the questions that we were having just now with the panelists. So I'll just hand over now to Erin, the second co-chair of the Health and Nutrition Working Group. So thank you all so much for taking the time to join us, and thank you, Erin. So over to you.
Thanks so much, Olumide, and thanks to our panelists for the excellent discussion and the really important points. Everything that you said resonated so much and I think is really important, and I won't do justice to it in a closing, but just to highlight points that I think are really critical in terms of takeaway. The international aid community needs to do better to shift the balance of power. We need to move beyond lip service, move beyond tokenism, and doing this will take significant shifts and processes in our approach to actually shift power to local agencies and national organizations. Listening to our panelists speak, it comes to mind that the capacity building frame that we so often use is actually pretty patronizing. Local civil society organizations, national government agencies, and communities themselves offer a wide array of critical capacities that we must leverage and use and harness and put in the lead in order to achieve success. Too often we're actually missing opportunities to improve the effectiveness of our work through more meaningful and equitable partnerships. We heard about how critical it is to engage national and local actors really from day one. Too often we come in with a program or a strategy in a box and say, now we would like to involve you, right? But in order to actually position our national and local colleagues as leaders, we really need to make sure that they're in the driver's seat in terms of identifying the problems, working together to identify the strategies, and then implementing them. There was a really rich conversation around this notion of accountability. First, we talked about the importance of mutual accountability and not just this idea that national or local actors are, accountable to these international donors, but actually that the international donors, INGOs, should also be accountable to national and local actors. But also, I was hearing a conversation as well, not just about mutual accountability, but also, I'm not sure if this is the best phrase, but multidimensional accountability, recognizing that national government agencies, members of communities, local organizations aren't a homogenous group. They don't necessarily all have the same interests. And so we can't lump everyone together as if they do. And it's about harnessing the different capacities, making sure that there are enough opportunities to engage across all of these stakeholders and position them as leaders in the programs in order to leverage the diverse capacity of all of these groups to achieve what in the end are our shared goals. So with that, I really want to thank our panelists and participants. It was really a wonderful discussion today. And I hope you have a great rest of your day. I believe that there is a survey that we would like everyone to fill out. Does anyone from SID-W want to take a last word?
I think we're all good. Thank you for mentioning the survey.
Great. Thank you so much, everyone, and have a great rest of your day and your evening.
Thank you.
Thank you for the opportunity to share.
Thank you so much.
Thank you, and good night, everybody. Bye-bye.